Hello, everyone.
Cashews and the peanuts.
All right, never mind.
Hi, everyone. We're just taking a few minutes to let everyone out of the waiting room.
Morning.
Morning, Beth. All right.
Sherry and Jen, we will have our guests doing screen share. So if you can just open that up for them. Thank you.
Is it
I don't know if it's closed, just as a heads up.
okay? I don't think it's closed.
Okay.
If it is, we'll problem solve that. So I think, Beth, did we want to do introductions in the chat?
Yeah, I think that would be great. We are a combined larger group today.
Yeah, so let's do that. If you could start in the chat, sort of either your role or what organization you're representing and name, that would be great. So I'll give you a few minutes. For those of you just joining, if you could just add your name and organization in the chat, or your role, whatever works for you. I hope everyone's doing well during this time. Like we have a big group today. You know, I was worried that we wouldn't have a good turnout. I know we have two groups combined in it, but still, I was worried that with vacations and the flooding and all of that, we might not have a big group, but this is great. It's going to be a good discussion. Great. Beth, did you want to do the welcome?
Sure. Yes, good timing. I was telling Jen, of course, my washing machine was just getting delivered right as we opened the meeting. So there's strong guys doing their thing. So good morning, Beth Truzansky, at the Deputy Director of Building Bright Futures. I'm excited to have you all here today. We decided to convene two of our VCAP committees, VCAP being the Vermont Early Childhood Action Plan, and that is really kind of our long-term, our five-year strategic plan for the state that helps us guide our priorities for the early childhood system from the prenatal period through age 8. And we monitor this plan through a range of ways. We have regional councils, and then we have 7 kind of issue-specific committees, like these two committees that come together, some monthly, some quarterly, and some other somewhere in between. And so we invited 2 committees, the Child Outcomes Accountability Team, which stewards and monitors Goal 1 of the VCAP, and the Early Learning and Development Committee, which is one of the committees that monitors Goal 3 of the VCAP, to come together because many of you are here and are kind of interested in how how children and families access services, and particularly this issue around access to autism screening and assessment, as well as kind of other developmental needs for young children. And this has been kind of an ongoing issue that's come up at our regional councils at multiple tables. And so thanks to our partners who are here today, we have Cheryl and Molly are going to start us off talking about some work with the Autism Work Group that they convene, giving us some of the big picture about why they're coming together and what the challenges are that they're trying to address. And then we have some partners from Department of Health and VCHIP talking about some work that they've done recently, and then we will open it up for discussion. Like with most VCAP committees, we are looking to share information, build those connections across our network so that you are more likely to be able to reach out to each other and be able to do our work and build that level of collaboration that's needed, but also identify what the system gaps and needs are. And BBF builds policy recommendations annually. Those are built here at the VCAP committees and then eventually brought to the State Advisory Council and endorsed. And we're kind of just starting in on that process. And so those are some of the things that we can talk about towards the end of the meeting. So our discussion around this topic will go until about 11:30. And then we will shift to the Early Learning and Development Committee, which is usually meets at this time monthly. We'll continue the discussion specifically about policy recommendations and needs that they've been seeing kind of over the last year. So others are welcome to stay on, but that is kind of the flow of the meeting. I do want to give a shout out to our co-chairs. So with Early Learning and Development Committee, we have a public and a private co-chair. I wonder if Dawn and Sherry, you can just introduce yourself, and then we can move on to our presenters.
I'll go first, Dawn. There you are. Sherry Carlson, I'm Chief Programs Officer for Let's Grow Kids.
And I'm Dawn Rouse. I am the Director of Statewide Systems for the Child Development Division.
Fabulous. Thanks all for being here. Okay, so with that, just briefly, that our desired outcomes for our meeting today, I'm just going to go over so we can try and all be on the same page, are to review data to understand challenges facing families accessing developmental screening and assessment, learn about the work to provide targeted efforts around screening, assessment, referrals, and capacity building across the system of care, particularly pediatric and family care providers, learn about the Autism Work Group convening to promote collaborative and flexible strategies to deliver family-centered care throughout a child's journey, from early identification and diagnosis through adult services, and then to be able to discuss potential policy recommendations and needs. So we'll see how much of that we can accomplish. So Cheryl and Molly, I'm going to hand this to you, and we have until like 10:25 or so for you all to share.
Great. Why don't we, Molly, is it okay? We'll both do introductions, and then I'm happy to, Molly and I co-chair the Autism Work Group, and there are a couple things for visual learners that I could share my screen and show folks. So as I said in the chat, Cheryl Wilcox, I use she, her pronouns. I am the Mental Health Collaborations Director at the Department of Mental Health. So I do a lot of coordinating and work with our other Agency of Human Services departments. And the Autism Work Group is one of the statewide groups that is interagency and outside of AHS that Molly and I co-chair together.
Yes. Hello, I'm Molly Bumpus. I'm a speech language pathologist, a board certified behavior analyst, and I've been working in the field of autism for about 25 years now in a variety of capacities, and have the pleasure of co-chairing the Autism Work Group with Cheryl. And this is interesting for me because I wear a lot of different hats, one of which is faculty at University of Vermont and communication sciences and disorders, but the bulk of my professional work right now is as an evaluator in the autism assessment program at UVMMC. So I'm the person on the other side of that wait list, which is a horrible place to be, just tell you. And so been trying to work through a lot of challenges and become more efficient and try to problem solve. So good to be here.
All right, I am going to share my screen, and this is where I'm more used to Teams. So in a second. Can you all see something that says Autism Work Group at the top? Lovely. All right, let me just all of your faces back. Yeah. So this Autism Work Group actually started in 2015, and there are a number of groups such as this that cut across ages and across departments of the Agency of Human Services. And so in my role, that's how I ended up as co-chair. We created the group November 2015. I will say, so this is a description. We actually have a web page on the Integrating Family Services website. I think Molly and I had sent that, but this, the website shows our membership in the group and what we're focused on. So I was thinking I would kind of give overview of this, and then Molly, I'll switch to our big strategic plan goals and pass to you if that works. So one of the things I will say that was fascinating as I was going back looking at things, you'll see on here, you know, this is our statement of the Autism Work Group and how we created it. So there used to be specialized autism specialists at Department of Vermont Health Access. We had folks at Agency of Education, and positions were cut and eliminated. And so there wasn't a collective space to really talk statewide about what are the gaps when we think about autism services, and what are the needs, and what are the themes we're seeing, and who are the providers. And so because of that, this group got created. And when we did the first statement of this, the statistic was that autism spectrum disorder impacted approximately 1 in 68 children. It's now 1 in 44. And it just is, and Molly, go ahead.
It's 1 in 36. It's 1 in 36.
Oh my goodness.
Yeah.
So that will be our
We gotta
next
keep
update
updating.
to this.
Yeah. Yeah.
It's unbelievable. So, I mean, it's significant. And what's been really nice about this group, we meet monthly. It's been virtual since COVID. We used to meet in person, and we did some hybrid. And it's one of those benefits of virtual that we've had really amazing representation from across the state. And we've continued to have that. So members from different departments, the Agency of Human Services, so Department of Mental Health, our Department of Vermont Health Access, our Child Development Division, Children with Special Health Needs at the Health Department, Developmental Disabilities Division of our Department of Aging and Independent Living, and then family members and providers and designated agencies. So it's an open group. Anyone and everyone is welcome to come. And we really, there's always a piece of updates. So program folks can give updates of when folks have had luck staffing or if they have openings. We also put together a resource list, and I won't say more about that. I'll let Molly talk about that with our strategic plan goals. But it really has been a place where folks have come together to talk about, you know, what we're seeing across the state. And at different points, you know, I think folks will understand it's because it's a mixed group of like some state government and external partners. We all have different roles. And so at different points, there's been advocacy at the legislature and other places. And so this group has become a place where we, you know, all of our meeting minutes are public, they're posted. Anyone can use the information and discussion we have to take it and advocate and elevate information in their different arenas. So that's been a really nice piece of this as well. So let me see. Did that switch to the strategic plan? Or are you still saying the same thing?
Still seeing the same thing, Cheryl.
All right, give me one moment to click out and back in. Our strategic plan showing now. Oop. How about now?
Yes.
Yay. Okay. Lovely.
Oh, technology.
Love it.
Yes. So one of the things we have constantly been trying to really clarify and hone in on is our strategic plan as a group. And so this visual just sort of gives you the big three areas that we've really identified as part of what we want our group to focus on. And the first is to look at the current system and identify flexible, creative, family-centered care strategies on how to help a child's journey from that early identification and diagnosis stage through adult services, which is a huge, it's a huge goal, right? So we kind of under that have looked at a few different things. The first being evidence-based practice, sort of, you know, ways to fund evidence-based practice. What are people doing in the field? What types of interventions are being done? Service delivery models. So looking at sort of across the state, what's happening with that. Professional training. So thinking about, is there somehow funding or ways that we can help train EI teams in these evidence-based practices with ongoing supervision or mentorship, family education around autism, what's available, what we can expect from service providers from diagnosis onward, and then improving transition, all transition. So that transition between EI and early childhood, that transition between school age into high school, and that transition beyond, right? So that's one of the needs that really has been spoken a lot about in our group, is sort of that cliff of services that occurs when a young adult exits school age and then goes into adult services. That's really been a struggle for a lot of families and young adults with autism. So that is sort of the first area that we worked on, that we look at, and then increasing those assessment supports and services. And of course, identifying assessment as a need in our state, access to assessment. One of the things we did was really, there was no clearinghouse or no place where you could just go as a parent or a professional and pull up all the resources that we have in Vermont, either, you know, whether it's a designated agency resource, whether it's a private provider, what it is. And so we worked really hard to many drafts and versions of this sort of resource map that we now have linked to on our website. It's a pretty comprehensive list of all the places that are doing assessment in the state, all of the, you know, sort of speech language pathologists, private SLPs, if you're looking for that, adaptive sports, whatever it may be. It's sort of a place that you can just go and find everything. And we are continually updating that as things change and move continually. We were thinking and thinking about doing a survey and thinking about what kind of data would be helpful. So looking at where are the gaps for kiddos in our state, what about the access to supports, what's happening there? So that's sort of an ongoing conversation we're having about what might be helpful to do in a survey data. And then that gap analysis to know where the gaps are and how we can work and advocate to make things better. And then the last big goal that we've had more recently is to educate the community about inclusion and neurodiversity, talking about universal design, talking about strengths-based programming, neurodiversity affirming goals for kids. We've had opportunities in our work group that's been really powerful to hear experiences of autistic people and their lived experience, which I think is really, really important to do. And so that's sort of a continuing conversation we're having about ableism and how we're all learning and working to make things better. So that's a really broad overview of some of the things that we've been working on. As far as gaps that we hear about a lot that would affect early childhood, wait lists for services. So, you know, having families kind of, oh, my child is identified, they need a SLP, but they don't have one right now, or whatever that may be. So sort of those staffing, as we all know, staffing shortages are affecting families. The care coordination piece, it's difficult for us at the Autism Assessment Program because we're with a family for a couple of days, and then we have a follow-up meeting where we talk about diagnosis, and then we have not had the capacity to do any kind of care coordination or sort of that bridge care, right? So sort of getting families into those services. And so we've been kind of pushing back on medical homes with care coordinators to say, you know, well, this family just got a diagnosis. Is there a social worker or a nurse or someone working as a care coordinator in your medical practice who can help them navigate this road of services? So that's definitely an area that we'd like to get better at. And some of the things that are happening that are good that I can share with the group is that I've just completed a project where we've created 4 educational modules for families that are waiting for an assessment, waiting for a diagnostic assessment. One of them is on sort of social communication strategies. One of them is on sensory. One of them is on how to navigate the road of supports. And one of them is on the diagnostic process and what to expect. So those are out there and will be on our UVMMC Autism Assessment Program website when we update it. But I think that will be a nice thing to kind of point families to who are waiting. And then as far as sort of speech language pathology gaps and services and that sort of thing, I have worked with VCHIP where I run a parent education program every fall and every spring for families who have just gotten a diagnosis for their toddler, or families who are waiting, but there's a suspicion of autism. And it's a free program for families, and it's like 9 weeks, and I do 6 weeks of education classes with parents, and then 3 of those weeks I do individual home visits with families. So it's kind of a nice way to be able to be working on something, learning some strategies, and have support from other parents who are really in the same place all at the same time, which I think is the most powerful part of the program. But it's a free resource that I'm finding, you know, not everyone knows about. So I wanted to put that out there.
All right, 10:23. I think we did all right. If there are questions, I know we have 2 more minutes. And I saw, Beth, that you put the website link in the chat. Thank you. Yeah, Alyssa.
Thanks. I couldn't find my raise hand thing. Thanks for seeing my actual hand. This is awesome, and I'm super jazzed about it. We have had a lot of requests from our teachers specifically around supporting neurodivergent children lately, and I'm wondering what the partnership here in the state has looked like with All Brains Belong, and if there's any collaborative work happening there. We at SEED tap into experts throughout the country in this space, and yeah, I would love to see how we could collaborate and both support these efforts and see what you have already happening there that we can pull in to support teachers who are requesting these supports as well, from a virtual standpoint.
Absolutely. So as far as All Brains Belong, Dr. Mel Hauser, who is an autistic physician who founded All Brains Belong, is a regular part of our group, a regular member, and she has actually presented to us on topics of neurodiversity, healthcare, lots of different things. She's been wonderful contributor to our group. And so we regularly, as part of that sort of clearinghouse of sharing resources, are aware and sharing the information about the wonderful groups that All Brains Belong has for kids. Just fantastic. So it's such a rich place for information. So we definitely are taking advantage of that and of Dr. Hauser as well.
Cool. Yeah, I would love to connect and see how we can pull in resources that we've been tapping into just throughout the country, outside the state too, and supporting teachers who also have these kids in their classrooms who are waiting for assessments and all that jazz, who we are supporting virtually with a lot of this. We're putting together a workshop right now with Sarah Beth Roder-Finger. Yep, great. You know that name. Awesome.
Oh yes, I heard the ground rounds yesterday. Yes, at UVM.
Oh yeah,
Yes.
Yes, and just look at like what else we can do to collaborate with y'all to support teachers here as they're waiting.
Absolutely. Yeah, let's have a conversation. That sounds wonderful.
Thanks, Alyssa. Any other questions for Cheryl and Molly? And we can also kind of come back to other gaps and needs that folks see after we hear from Adam and Heidi. Okay, so with that, I'm going to transition. We have Adam Poulin and Heidi Schumacher here. Adam's from Department of Health and Heidi from Vermont Children's Health Improvement Project, and would love to hear the work that you've been doing.
Thank you so much. It's wonderful to be here. Again, I'm Adam Poulin. I'm the Children's Special Health Needs Director at the Department of Health. I've been in this role for just going on 2 years, and I've been with CSHN for going on 7 years. And previous to that, I was at the Howard Center for about 10 years and background in education otherwise. So it's wonderful to be with this group, see a lot of familiar faces and plenty of new faces as well. We have some slides we'll go through here and try and stay really on schedule. But Heidi, please, if you want to introduce yourself too.
Absolutely. Hi, everybody. Thank you so much for the opportunity to be here. I am Heidi Schumacher. I am a general pediatrician with the Vermont Child Health Improvement Program. I trained at UVM, but then actually was in Washington, D.C. for the last 13 years, including 7 leading health for DC schools and childcare. So now just came back to join the VCHIP team about 6 months ago. And it's been such a joy to lean in on this really amazing, complex, interdisciplinary work around developmental screening and assessment. So thank you for having us.
Great. I am going to attempt a graceful screen share here. Okay, I can still see some folks' faces. Molly, I can see you. Can you see my screen? Yes.
You're good, Adam.
Oh my gosh, okay. Someone should tell the state that Zoom is a little bit slicker than Teams with some of this functionality. Great, okay, wonderful. So, like I said, a lot of familiar faces in this group here. So we're gonna run through some slides. I strongly suspect a bunch of you all have seen a version of this presentation as well. And I hope that's okay. Part of me wonders how many of you all were on the Pediatric Grand Rounds call just yesterday and saw Dr. Broder-Fingert talk about her work and research. Part of me wonders if we should have just had her come along to this meeting today as well. And I just to indulge in a little name dropping, I think we got connected with Sarah Beth through Morgan Crossman, if I'm following the history, right? Okay. Wonderful. So these are some slides that talk about this project work. These are slides that, with this group, I'm intending to share what we've been sharing with the community over the last 7 or 8 months in terms of like talking more intentionally about the work. So we've evolved these slides over time as the work has kind of progressed. But Brina Holmes is another one of our core team members here. Some of you are probably very well familiar with her as well, but she couldn't join us today. So we're going to move through this, and we'll have some time for questions here. And I'll just invite, we're talking about a narrow element of the larger conversation here around autism services for children and families in Vermont. So acknowledging that, this project is not going to come in and be panacea. I don't think anyone here expects that. And it's just following on Cheryl and Molly's presentation, close partners in this work, that the work group is just such a strong source of, I think like they spoke to the diverse folks that comprise that group. What a source of advocacy, networking, problem solving. They can kind of do it all. So again, I invite this group, just like the autism work group, like if you see things that stick out, that don't quite ring true, we want to know. We're going to continue to evolve this like a stone in a river here. Okay, so I'll turn the mic over to Heidi to talk about how this work fits in a part of a larger VCHIP project that's underway post haste.
Absolutely. Thank you, Adam. So Molly, I really loved seeing that second arm of your strategic plan for the autism work group, because I think the VCHIP quality improvement project that we are embarking on, essentially starting now, and then official kickoff in early fall, really aligns very much with that second strand, which is that we here in Vermont, just like I think really every state in the United States and internationally, have limited capacity in terms of the specialists that are trained to do autism assessments. And for those of you who joined Dr. Broder-Fingert's grand rounds at UVM yesterday, she is a national expert in this work. And she essentially said, and I think this rings true for us, the future of autism assessment for many children, she sees really happening in primary care, not in a subspecialist's office. And we are part of, at VCHIP, I think, that evolution to really elevate the role that a primary care doctor, the trust that that provider has with their patients and families, and the partnerships that that provider may have with many community partners, including many of you on this call, to be that sort of quarterback for getting an assessment potentially completed, at least for some families, without needing a subspecialist and the corresponding wait times there. So we are leaning in with practices across the state on one of three. The practices can choose from one of three arms, which are listed here. So unsurprisingly, as we've gone out to practices across the state these last number of months, many have said, listen, we know that doing these next level autism assessments to get to a true diagnosis is a need, but we really feel an opportunity to get back to basics with our Bright Futures aligned developmental screening protocols. And so we welcome practices to come in to work with us on getting screening done in the first place, timely evidence-based screening. The second cohort is going to be a group of providers, and I'm so inspired by the diversity of types of providers and geographic heterogeneity across the state, of folks saying, yep, we maybe haven't been trained in doing autism assessments in primary care before, but let's jump into it. Either us, the provider, him, her, themselves in clinic, or really cool to hear about partnerships with early intervention teams and other partners who are also raising their hands saying, we want to jump in here too. And so I think lots of opportunity there for different models to get the next level autism assessment done in the primary care clinic and or in partnership with the EI teams. And then a third cohort were practices who are saying that they really want to do both. They want to lean in on developmental screening, sort of standard protocols, and they want to think about how they can support some next level assessments being done in primary care. Now, we mentioned here that it's flexible. That's been a real important part of sort of meeting practices where they are and their partners. and that we at VCHIP, with the support of Adam at the state and many other partners, including, again, many of you on this call, will really be helping practices and partners, EI teams, private practitioners, others, to really think about how we build an integrated network in this space of sort of community-based autism assessment. Dr. Broder-Fingert, for those of you who were on her talk yesterday, and certainly I think many of you know her, has really made the point, which resonates for me and I think for many of our colleagues across the state, that this community-based autism assessment may not work for every child and family, that there may be some families with more complex presentations, comorbidities, et cetera, and the subspecialists and other highly trained folks will be forever essential as part of this integrated framework. But I think our goal is to figure out for that cohort of kids and families who maybe have a more straightforward diagnostic picture. We believe that there is capacity across the state in the primary care space and with partners. And we are so just excited to jump in with these three strands. So we are finalizing details with Dr. Broder-Fingert from UMass, who will be training a cohort of providers in August or September. And then otherwise our project will kick off in October and really support practices through the year to come.
Wonderful. Thank you. Thank you. I'll keep moving unless there's any questions in the meantime here. Great. So again, the rest of these slides, have been used to socialize this work across the state with a variety of stakeholders over the last 6, 7, 8 months at this point. So we are now going from the VCHIP CHAMP projects into that one arm, as Heidi referred to, around autism assessment. So you know, when we do this presentation, we talk about the context and the background, some of the project goals and objectives, what the work has looked like to date. You know, the interactions and input we've picked up along the way. We try and call that out and then talk about what's next here. I wish I had a chance to do another version of this following the presentation yesterday, and then even following like Molly and Cheryl, because I think, you know, they've rightfully so, those already stolen some of the thunder here. So, but nonetheless, we'll go through this. So context and backdrop, like Heidi said, like we know, this is not a Vermont specific problem. It's not a U.S. problem. It's when we think of the explosion in autism rates, this is a global problem. I wish I wasn't harping too hard on that, but it's the reality that people are facing everywhere. So, being more specific to Vermont, the model of the Child Development Clinic was in place for quite some time. Employed a developmental behavioral pediatrician and a team of specialists that did these team-based assessments, very comprehensive. That model, for a variety of reasons, wasn't gonna stick, and I'll just put that to the side for a quick second. But the process of closing the CDC and moving assessment capacity to UVM Medical Center started around 2017. I call out that there's the impact of the COVID response affected that closure process because it took staff resources away from that group in pretty impactful ways. So we talk about the process of recruiting a developmental behavioral pediatrician. Dr. Beth Forbes came to the state 5 years ago, as she confirmed yesterday. Feels like, you know, time flies, especially when you spend three of those years in the pandemic. And then there's been, you know, a lot more work more recently to blend the BCCYF clinic and Dr. Forbes clinic, and we see that work ongoing, right? So some other factors contributing to what we're seeing in Vermont is there's the model change with like that main source of assessment, staff retirements. We've seen ongoing increase, you know, high referral volumes leading to increasing wait times. And then as we know, at the end of last calendar year, the UVM clinics paused on new referrals and are you know, hard at work to reopen and have new capacity and new model. So some other this kind of potpourri, if you will, the miscellaneous, the additional background here. One reality we've been trying to, like, really with agility respond to and learn about is this diverse policy and regulatory landscape that this work at large really takes place across. So we can talk about autism diagnosis in the context of accessing Vermont Medicaid services, in the context of accessing perhaps school services, and everything in between. And as I can probably already guess, that landscape is diverse, it's heterogeneous. It is not fully integrated. It is like the requirements for autism diagnosis, or what you need a diagnosis to access in one part of the system of care, is different than another. So trying to understand those contours and report on those and bring clarity wherever possible, or just like sit with the complexity when that's just the reality. That's been a part of this work as well. So again, I can't imagine this is going to knock anyone's socks off, but goals and objectives here. We're talking near term and long term. We want to build capacity for autism assessment and reduce wait times. And by focusing on a primary care setting to do that, that involves, or implicitly involves, reserving subspecialist time for children with the most complex presentations. And then, at the bottom here, increasing access to autism support and other support services. Those are some of our core goals. And so some objectives along the way. We're very close to having the final details in place for a training series, a training program for physicians and on an autism assessment tool. Like that's in some ways that's like the step one. Everything to date has been table setting. And we really want to understand the policy landscape. And then the last piece at the bottom here, we want to identify and support current partnerships, and then learning from that, work to build new connections. So, a theme that's just like really emerging here is like there's really no one size fits all for autism. Like there's no one size fits all type of assessment. You meet one child with autism, one autistic child once. You met them once. And I think that saying I think really carries forward here. So with that in mind, we've learned and we're well aware that in different parts of the states, like different teams have figured out ways to get their kids assessed and moved along into accessing services. And so this project has not been undertaken with the mindset of like, here's a model off the shelf. This is how it's going to be. We want to understand what's working. We don't want to disrupt that. We want to look for opportunities to highlight what's working in other parts of the state and identify, where there's an opportunity to maybe try something out along those lines. And so, really to try and bring that home, like some of the folks we've talked along the way, which I'll mention in the next slide, is community teams, EI teams, and where are they partnering with primary care already? Where are they partnering with subspecialists already? And what can we learn from that? Where can we look? Where is that not happening, and potentially where could it? So, moving along, just a quick review of the work to date here. The timeline is fuzzy. I mean, like I said, I've been in this role just approaching 2 years. This was not a new topic when I stepped into this role, and folks were already talking about it. And so conversations are happening towards the end of 2021 for sure. But I'll start the clock here with some conversations with some key stakeholders across AHS. So folks from all of our sister departments, Department of Mental Health, Vermont Health Access, DCF, talking about opportunities to move forward. We at that point did call in our favor and engage our close partner Brina Holmes, who during this first early phase, did some research into different system design. So some of you may be familiar with Dr. John Dubey and something I think colloquially known as the Ohio model, which builds capacity for autism assessment, collaborating EI and primary care. So that's just one example. Brina did a ton of the key informant interviews, probably folks on this call, engaged her contacts at the Academy of Pediatrics, and then children with special health needs at that time. As we were, I think part of this work is like really wanting to understand, where are the real knots, if you will, where are the real problems and where are they not? So to move from like this a general sense of this is a crisis, like everything's broke, to no, we can like really identify the true gaps and whatnot. So the CSHN team that last summer got some input and built a couple of resources, kind of similar to what I think Molly was talking about. I think maybe there's an opportunity there. in the absence of an autism diagnosis, while you're waiting, what can you still do? Because in fact, you can still, a family can still access a host of services and supports. I don't mean to suggest there's not a problem, clearly, but let's just, let's worry about the right problems per se. So there's a resource that's online. We've shared it with primary care through our contacts. I would hope some folks here have seen that. So just moving forward here, quick time check. Shoot. We started to hone in on opportunities to build capacity in primary care, more research into the regulatory landscape. We got, serendipity struck, and we got connected with Dr. Broder-Fingert, initially to just understand her work and consult, but the option to bring her in and then collaborate with her on a training program really started to kick off at the beginning of this calendar year. So in bold, you'll see reference to a tiered diagnostic approach. That's a model, the name of a model that Dr. Broder-Fingert has, done some research and journal articles around. And that, by and large, that's kind of what we're working on here. So we've been socializing this project and kept chatting with community teams, wonderful partners in the CIS world, Autism Work Group, different community teams and primary care practices, BCHIP certainly. And this brings us roughly to date here. So this slide is intended to show the regulatory landscape a little bit. It's a relatively new slide, gives me a slight headache, and I think I just need to sit with that. So this references some different sources and owners of policy or rule or whatnot, and it links to relevant instances of who can diagnose autism, or what are diagnostic requirements in terms of the tool used or the provider credentials, and it just intends to kind of bring them together. This is a work in progress. I want to evolve this and bring in more. I'd love to reformat it so it's a bit more visually appealing. But you'll see just very, very quickly, like throughout this work, like I said, trying to understand, where is there just a misconception of something, for instance, like accessing Medicaid covered applied behavioral analysis. Those providers need to ensure a diagnosis is in place. Yes. The guidelines that describe those providers are not exhaustive. A board certified physician, pediatrician, is within their scope of practice. They've been trained on an autism assessment tool to confer a diagnosis. So this you'll see this moves down. It talks about some regs at the Department of Disabilities, Aging and Independent Living. Talking about autism diagnosis in the context of developmental services takes on its own flavor as well. I'm sure there's a choir here, but developmental services are for individuals who have an autism or an intellectual disability diagnosis, as well as co-occurring adaptive deficits. So some of you have heard me say, it's very few and far between can we talk about autism diagnosis in a vacuum. In my mind, it's always towards something else. And so talking about the DALE regs, their regs also call out specific providers that are required, provider types that can make a diagnosis. So we'll share this out. I want to move on. The last one at the bottom is the biggest kettle of fish. What do we want to call it? Like special education, school services. Clearly, they look at a child's education needs. The role of assessment of diagnosis in that setting, is the hardest to account for here. And I don't mean to sound pessimistic or to cast aspersions, but I think it's just sitting with the reality of how diverse the landscape is here. That accessing special ed does not focus on who granted the autism, who conferred the autism diagnosis and what tool did they use per se. So it's part of the complexity we're trying to address. Okay, so a bit more just broad commentary, some things we've heard along the way here from a variety of folks, starting right at the top, there is just widespread desire to help in general. And that is held in tension and counterbalanced with the reality that providers, whether it's primary care practice or a EI team, need to understand the logistics. How's it gonna look? What's their workflow? Everyone is strapped. What's the financial picture gonna be like? So we know if people want to help, they can understand what it's going to look like. I think we've heard very clearly that anyone who learns autism diagnosis, there's a learning curve there. They want their diagnosis to stick, right? And so, what are the elements of a high quality report? how can we imbue this training series with that? Or how can that be an output of this training series? You know, someone talked about All Brains Belong, and I know the autism work group is a strong source for neurodiversity perspectives. And so, you know, how is this work? How does this work intersect with different models of disability, the medical model versus the social model? How is the neurodiversity perspective? How can we honor that, amplify it, incorporate it into this work? So anyone who saw Sarah Beth's talk yesterday, I think, you know, my hope is that we're kind of like speaking within the same conversation on that here. And then, you know, the second close, the meeting the DSM criteria, that little does not equal sign, that just means to suggest like autism diagnosis and such, meeting the DSM criteria does not in and of itself translate to developmental disability services or IEP services, a home and community-based waiver, Social Security benefits. So I think that's something we just need to be really clear about as we embark on this. You know, I'm almost out of time. Here I am. And then lastly, just, you know, a little saying that I've kind of picked up, that it's a clinician that makes a diagnosis, not the tool. So, you know, there is work around the state looking to build capacity, assessment capacity, using different tools than the main tool that Dr. Broder-Fingert will use for our training series. I think that's great. You know, there's no one size fits all. We've got to keep that in mind. Okay, so I'm gonna really hastily move forward here, knowing that I'm at time. So tiered diagnosis, again, you know, a board certified physician who's trained on a standardized autism assessment tool, who feels confident, feels comfortable, has had, you know, consultation support, time. They're within the scope of practice making a diagnosis. And at times in this project work, it's been very important to kind of say that loud and proud and on and on and on. So you'll see that reflected here. So we are partnering with Dr. Sarah Beth Broder-Fingert and a team from UMass to do this training series. And then going forward, we want to understand what providers and practices will need beyond the initial training series to support their work. This last piece in italics here, this when in doubt, refer out, it's a saying Sarah Beth used yesterday that I'm just openly quoting from her here. I should put it quotes, because to build capacity in the system of care and primary care settings, it's crucial that providers understand, you know, which kids are appropriate to see in that setting, and which kids do need to go see Molly's team or another source in the state. Okay, so these presentations end with like an invitation for conversation, 2 ways here. So, you know, we want input, poke holes in this, tell us what doesn't ring true, you know, what data is available that could help inform this work. And so I have this slide, and then another version of the slide I've used more specifically with community teams, just trying to be clear that like, we do want to understand what collaborative practices are already out there. How can they be supported, not kicked to the side or disrupted in any way? So,
Adam, can I just jump in? Because I saw a comment in the chat and I want to just follow up on one question you had here. I mean, we are in the process of building out training opportunities for pediatric and family practices that come into this quality improvement project. And a huge strand and one of our key drivers in our key driver diagram is all about collaboration. So please know that we may have already met with, I know we've met with many of you already. And one of the things that I'm most excited about is, as Adam said, lifting up examples of collaboration that's already happening with excellence so that others can learn from it. And we are not replacing that or coming up with alternatives where it's already working. We're really about finding solutions where there are gaps. And then Anne, I saw your comment in the chat about STAT versus MCHAT for screening for autism in alignment with Bright Futures. So the American Academy of Pediatrics and Bright Futures don't endorse or approve tools, but they simply give examples. And you'll see in the fine print all over the place, they say, these are examples, this isn't exhaustive. In the Bright Futures Time toolkit that I've seen most recently, they list MCHAT and the SWIC, the Survey for the Wellbeing of Young Children, as examples there, but I've seen other tools listed in others. So I think most practitioners are still using MCHAT, but I know there is interest in considering other tools for all the reasons that we know about cultural competence, et cetera.
I just wondered if there was concern about the STAT starting at 24 months and the guideline to screen at 18 months.
And Heidi, for those of us who are not in the medical world, can you just reference what Bright Futures and what that you're
Yes.
referencing means? Yeah.
Yes, forgive me. So Bright Futures is the tool written actually by 3 experts right here in Vermont. It is the best practice for all of pediatric practice across the country. It's essentially how the toolkit that practitioners can use to align, to basically figure out how to implement the recommended screenings, diagnoses, services, et cetera, especially within Medicaid programs, EPSDT programs. So it's essentially the how to map to the what in terms of recommended screenings, et cetera. And so Anne's question was about specific tools that might sort of count or be included in Bright Futures. And as I said, Bright Futures is really not an endorsement body. It's rather a really beautiful resource, again, written all by Vermont folks right here in our great state that guides the pediatric practice across the country.
Thank you. Amazing information. I wonder if there's any clear, I would love to have a kind of a systems conversation and hear from folks about kind of their, your experiences in working with children and families. But if there are any kind of follow-up or clarifying questions for Adam or Heidi right now.
I do have one question. This is Heather out of St. Albans. I've seen recently some information about the negative predictive value of the in medical home assessments. And so I guess I'm a little bit worried about the when in doubt, refer out versus having maybe a more systematic way of maybe it's all of the negative results, right, within the medical home would then go for a second look. And from what I can tell, we're not talking small percentages. I've seen as high as 40% miss rate. So I wouldn't want us to lose sight of that in our planning.
Can I comment on that one, Beth? Heather, that is such a great comment. And I don't know if you heard Dr. Broderfinger's grand rounds yesterday, but she spoke to that explicitly. And actually I listened in on an amazing talk by this researcher in Canada, Melanie Penner, whom some of you might be familiar with. She presented on much the same thing. And the bottom line is, as you said, there are groups of children for whom diagnosis in the medical home setting is really it makes a ton of sense, where the primary care doctor is confident in the diagnosis. Actually, that's one of the leading indicators of accuracy in the diagnosis. If the presentation is pretty straightforward, the primary care doctor feels confident, it is highly likely that child will be diagnosed accurately with autism. And this group in Canada has actually compared accuracy of diagnoses in the medical home and in subspecialty care. And in some scenarios, they are quite concordant, in others less so. And Heather, I think you're picking up on that same thing. So part of our job, you're absolutely right, is to help practitioners in the field figure out, are there scenarios in which it's really not appropriate for them to make the diagnosis because of complexity, because of comorbidities, et cetera. That's where much of that negative predictive value comes in, and to figure out how the system comes together to support those kids. I totally agree. Thanks for raising that.
Any other clarifying questions? Okay, I'd like to invite us to take a step back, given the information that we've heard. Thank you, Adam and Heidi. And to hear from the group that's assembled here, which really presents a very wide array of folks who are working with children and families or working with the systems that serve children and families. So what gaps exist in your community related to screening and assessment? What's your experience in terms of how do we better support children to receive a diagnosis and the supports that they need? Are there any folks who want to share? Yeah, Sonia, go ahead.
Yeah, so
Sonia, if you could reintroduce yourself just so
Oh,
that
I'm sorry.
we're-
It's Sonia Raymond, and I'm the owner of Apple Tree Learning Centers in Stowe. So we have children on the wait list, some of who have been on a wait list over a year, going on almost 2 years now for a diagnosis. So in terms of early intervention and early diagnosis, we're certainly missing the mark there. We've also got what I see it's alluded to in all these slides and things, a quality issue around diagnosis as well, in terms of like, some are very thorough, very involved with, you know, all service providers, all of us here at the program, as well as the parents and others that are very sort of surface, I'll call it, feel very different, don't feel very thorough. Even some like reports we've gotten back in one particular child with completely inaccurate information regarding services that have been happening or not happening. Just very odd. So to me, those are two major things. But you know, my biggest concern is just around us being able to have a diagnosis in a timely fashion for a child so that they can get the services they need. I mean, for the children that we have, and we have several children formally diagnosed with autism here, we've been able to get the services that we need. We have literally seen those kids make huge growth. And so therefore they then enter public school much better prepared. So for me, those are like the key pieces that I see you addressing in here.
Thanks, Sonia. That's great information. Alyssa, if you can reintroduce yourself.
Yeah, sure. Hi, I'm Alyssa. I'm the CEO of Seedon. So we support teachers with a virtual platform, professional development, and ongoing coaching, OT, SLPs, PTs, and psych. And one of the things that we've had actually really recently with 2 kids specifically here in Vermont were kids who went through early intervention, both received OT and SLP supports, and then aged out of early intervention, and about a year or so later for both of them received an autism diagnosis. And they had a really hard time in those first few years of life, even with early intervention supports. And now they're receiving some different and more specialized supports for autism. And we're seeing different kids in these classrooms. And so I'm wondering, yeah, I guess I'm curious about what it's going to look like to support our early intervention system here for that earlier diagnosis. And I think specifically within our OTs, we've worked with Hannah Bloom a bit on this as well. But yeah, that's what I'm curious about here, so that these kids aren't just getting the support at 4 or 5, but that especially when they're in the system already, they get the support they need.
So Alyssa, I'm going to hold on anyone responding to that question and ask if there's others who want to kind of share your experiences, and then we can kind of come back to discussion. Thanks. Yeah. Jocelyn.
Hi, I'm Jocelyn from Bennington County Head Start, the Mental Health and Disabilities Coordinator. What I find in our area is there's been an increase in autism, but the wait time, like everybody else is talking about, we're seeing as well, which is really struggling with the classrooms, helping to help support those children with that wait period of that longer time. So I also I like the idea that the pediatricians might be able to be that middle person of helping to get support for children faster, and then the more complex going further, but that will give us support more in our classrooms, I think, too, by being able to do that. I know in our community, we've been partnering a lot with Learn. They are new coming into our program, but we've seen a rise of Learn providers in our classrooms because of the increase of autism in our community. So I do like the idea of having the pediatricians going through those trainings and being able to maybe screen and diagnose sooner.
Justin?
Beth, I just wanted to add one more thing I totally forgot to say, but super important. We have one family with a child who, again, was on the list over 1.5 years before her name came up. And her mom is a single mom who has a mental disorder. Good morning, everybody. And, oh, sorry, am I talking over somebody? The support for that family to fill out the paperwork was so involved and so complicated. And the case manager, special ed case manager from the public school, worked for over a month to try to help this mom get through this paperwork. And it was really unbelievable. And was sending UVM the paperwork she could get the pieces done. And eventually they just dropped this girl off the wait list and moved on because they couldn't get the paperwork done in time and would not put them back on the list. So very disappointing. Probably one of the highest need students we've ever had here. Very involved in multiple ways. So those supports for families in the paperwork, I just want to mention that as well.
Thanks, Tonya. Jocelyn, can you, going back to Jocelyn, can you say what LEARN is? You referenced Katie McCarthy.
Yeah. They come in and they provide ABA services. It's through Medicaid with some of our families. Our families create the partnership with the families, and then we give the space. They come into our program. Some children get LEARN services with an ABA provider for up to 4 hours a day, every day. Some children, it's different. It's really individualized. But that's also been a support for some children in our classrooms. It's not just specifically for children with autism, but it's been a helpful support for children in our classrooms, especially our younger children.
So is LEARN a Bennington thing specific, and is it related to CIS? Do you know?
So LEARN is
thanks, Jenny.
Yeah. LEARN is an ABA program. They aren't just specific to Bennington. I had Marcy, who is the BCBA, reach out to me and look for contacts in Rutland and Chittenden County. So I think they're spreading throughout the state. So they used to be SD associates, and then SD kind of transformed into Benchmark, and then Benchmark transformed into LEARN. And so it kind of there was a shift in providers, and now it's LEARN. And we also have Green Mountain Sprouts has a facility down here that serves about 10 kids. And that is actual facility that a child can go to for 8 hours a day. They bill Medicaid, and they receive ABA services. So early intervention, usually for the birth to 3 kiddos, we're the ones who make those connections and get them situated for early Head Start. If the child is in that need of that type of service, we will coordinate that, organize that. The developmental pediatrician that we currently use is Dartmouth, and we have set up a telehealth system where some families can receive a diagnosis over telehealth, depending on the needs of the child and if everybody is on board with the diagnosis. So we have streamlined some of those kiddos where the parents are aware. I just got a referral today. The mom said, I have autism and I know my daughter has autism. And I said, is she officially diagnosed, or are you just know the signs and the symptoms and you are saying that she has autism? And she said, I just know it because I'm autistic myself. So I said, well, we can do this wonderful telehealth appointment with Dr. Stan Loud. It does require a whole stack of paperwork. It is a lot of prepping to get that situated, but for that family who just called me, the child's over 2, I will do the paperwork, send it in, and Dr. Stan Loud will schedule a telehealth that we can have the family come to our office instead of transporting all the way up to Dartmouth for a 2.5-hour drive. And she will diagnose right over the telehealth screen with the family present. So we have implemented that, which has streamlined quite a bit of our referrals to the developmental pediatrician for a diagnosis. We just cycled out a whole bunch of kids to the school system. So now I probably have about 25 that I need to get diagnosed again. So I'm starting over with a group of kids. We just transitioned 10 to 15 kids to the school they are officially diagnosed, all situated, have all the services. but this is kind of the rounds, it goes round and round. So we start over again and get all the paperwork done, get them all scheduled. But I have heard like good feedback from the school that they do appreciate us getting them diagnosed earlier. We have those conversations. We do that a lot of times. I was going to talk about the MCHAT and the ASQ screening in the doctor's offices. I think those are great and wonderful, but I also think that there's more work that could be done on that with the doctors, that just handing a parent a piece of paper and having them fill it out is not always the best way to do a screening. A lot of parents have, they're reading the questions off the MCHAT and they're not understanding exactly what those questions are asking. So we do a lot of, we get that MCHAT and say we assess the child, and I'm like, oh, like I'm seeing all of this, but according to your MCHAT, like you said yes to all these questions, but as I'm explaining the question and demonstrating what the question is asking, they're like, oh no, she doesn't do that, or no, he doesn't do that. So the questions on the MCHAT are incorrect. And so then I have to go back and do like the MCHAT follow-up with the family and say, why don't we walk through this and see, what questions you might have answered yes, but as we go through it, it might not be a yes. So we end up doing that. And then that really kind of does that conversation with the family easier than just saying like, here's our opinion after the doctor just said everything is great and wonderful and your child just has a speech delay. So I do think there's some education that could be done with those screenings in the doctor's offices, but I do know that there's limited time for all of that. So that's kind of my 2 cents.
Thanks, Jenny. Appreciate it. Katie, your hand's up.
Not to get too far out, I really appreciate this conversation and the information that was presented today. I did want to raise one concern that has been kind of sprouting up in some school districts, and I think it's part of a larger conversation. But what we have seen in some certain areas of Vermont is an increase of some private ABA companies kind of coming up, which don't always communicate well with the school district as far as a child that may be on an IEP. So what can possibly happen is the family being given a choice to accept the services from the school or give up their FAPE in the LRE. So, I mean, it is a larger conversation in early childhood. So, and Cheryl, I would love to be part of your work group or with that, but we are seeing kind of an increase in certain parts of the state in children maybe having and families having to give up their FAPE in the LRE and going to a straight ABA program with no kind of plan to come back to the school system. So it's just a deeper conversation I wanted to bring up here. Thank you.
Katie, we would love to have you. I saw Molly shaking her head yes too. So we'll get you the information, and there are a lot of ABA providers there, and so it's a good place to be able to talk about this as well.
Thanks, Katie. I would love, it's great to hear from people's experiences. So thank you for sharing kind of experiences of educators and folks running childcare programs and CIS programs. Would love us to also now think about policy needs and recommendations. So whether it's the State Advisory Council or our collective consideration about where the policy gaps are. I certainly am, we know that capacity is an issue, right, in terms of who is actually able to do assessments, and also have heard some gaps around kind of families accessing and being able to complete the paperwork. And it sounds like in some cases, like Jenny, you're working with families one-on-one to be able to complete that paperwork, which is pretty extensive. What are some policy needs at this point? And this is a brainstorm.
I think I'm Dr. Moran. I'm also a general pediatrician, but we have a small hospitalist program here at NMC. We also have a kind of unique circumstance that one of our pediatric providers is actually a pediatric nurse practitioner with subspecialty training in developmental pediatrics with over 10 years of experience, who has relocated to Vermont. So in collaboration with our designated agency, NCSS, and I know Amy Johnson just hopped off, we are planning on and starting the process of having a part-time developmental clinic here at NMC in collaboration with NCSS starting in August. We're going to start with local families that have been on these long waiting lists, who will meet with Katie and some team providers through NCSS that we're all going to go through some training together in August to help build that collaboration. So it'll be interesting to see how this rolls out. And our goal is to hopefully potentially be able to expand it to increase access for those kids that need assessment beyond what is available in a primary care practice. The one thing that I think about as thinking of my hat as being a primary care pediatrician previously is the reimbursement for the amount of time that these assessments and the preparation are going to take, and that the current payer system for a primary care provider to gather all of the information through their early intervention services and those types of things, as well as the length of time that I know has come up from other folks as well, right? Like sometimes families can fill out an MCHAT quickly, or thinking about the CARS 2, that the current system is not going to reimburse at a rate that's going to potentially make this doable as a, so I look forward to how we can help support and advocate for that. Again, it's part of that much bigger conversation of the needs of mental health and co-occurring diagnoses. I would say the other really big limiting factor is IQ testing, right? So a lot of children are going to potentially maybe come up as flagging as positive on some of these screening tools for autism when they truly have an intellectual disability, right? So a 6 or 7 year old who's still doing parallel play might not have autism, but might have a significant developmental delay. And there's really not, unless I'm missing some resources that I'm not aware of, and I'm happy to, if anybody knows of any, but that, you know, IQ testing, especially for that younger population or even the school age kids, is pretty limited, and access to child psychiatry in general, which is part of a much bigger conversation. So I'm excited that there's all these incredible people that are focusing on something that we've, you know, had identified a significant need for a long period of time.
Thanks, Colleen. We're really excited about your work at Northern Vermont Medical Center and that you could be here today. Other considerations around policy, would love to hear. You know, Alyssa, you brought up this issue around resources for EI, you know, and if we're doing earlier diagnosis, you know, what's the lever that folks feel like needs to be enacted to be able to do that? So we've heard around reimbursement rates, talking about it's you know, something around family supports to help families be able to navigate the system and access the assessments. Anne?
I don't know about a policy lever, but in response to what you and Alyssa were just referring to on a practice approach, and I think through VCHIP and you know, the different projects, anytime we can promote, and I think Sonia was also talking about looking at the whole team around the child and family. So, you know, the primary care provider drawing on the CIS early intervention or early childhood special education team, you know, and obviously the family, and looking at getting input from, you know, those multiple sources and seeing what resources are available to draw on is going to only help. So I think the less siloed we can be and the more inclusive, that is I guess a practice lever.
Yeah, thanks. Katie.
Hi. So I don't think I arrived late because I had another meeting. I'm Katie Leffel from Department of Health and the Family and Child Health Division. And I did also attend yesterday's grand rounds, and you brought up something that we had a little bit of a discussion around at the end in terms of Dr. Metz had brought up when children experience childhood trauma and then present with, you know, autism spectrum kind of symptoms, and then you know, have that diagnosis. And we were having a conversation about that, and then I had put in the chat at that point around prenatal, early infancy supports in the home to prevent sort of that, and then also incorporating those supports into exactly like the multidisciplinary team. And it really, so I love that you brought that up, Anne, because that's one thing I wasn't going to raise my hand and say anything, but since you brought it up, I think that's an excellent point, is what are the supports we have in place in communities already, because we have a huge gap that we know we're talking about right now, but what do we already have and how are we using them the most effectively as we can? How do we support that family with the services we have in place, the capacity we have in place, and then also add in other pieces?
We do early intervention in Bennington. We do a lot of, you know, we ensure that the developmental pediatrician, wherever we send them, we utilize Dartmouth to the fullest, but we also utilize Albany Med and things like that. I am a big advocate for like the developmental educator to attend the appointment with the family as a support. So we always ask the family if they want us to go, and if they don't, that's perfectly fine. But many families really do want us to go because they, first of all, have a good relationship with them. So they trust them and they're willing. It's difficult. I mean, we have to reorganize schedules and do a whole bunch of stuff, and it takes us 2.5 hours to get there, and I have to reimburse mileage and time, and you know, you have to leave at 5 in the morning if it's an 8 o'clock appointment in the morning. So it's a lot for the team to do, but it's really it's great for the developmental educators to watch the developmental pediatrician and watch the system and how it is and the approach that they use and how the conversations go. But it also gives the opportunity for us to share information with the developmental pediatrician and ensure that they have copies of everything that we have. So OT, PT, speech, R1 plans, our assessments, all of that goes in a giant packet to the pediatrician. So that collaborative approach is really important for us, especially with them. Some places we get more where like Stand Loud will call me directly and be like, hey, I don't have that one plan. Can you send it to me? Other places I don't get that as much, but depending on, you know, who is doing the assessment, it's nice to have that relationship in order to assess these children as a whole. And I do value that. And I think that's really important. And it can help rule out some of that, you know, trauma versus autism versus we're not really sure what's going on. We've had a few kids like we've sent up really early and cognitively they're not at the point where Stand Loud is okay with giving an autism diagnosis. So they will have to go back in 6 months. And that's like there's a follow-up piece to all of this too. So kids that do get a diagnosis, they end up having to go back anyways to kind of be followed and monitored. And she wants to know what services are they getting and, you know, what services do they need to be getting, and looking at it as a whole picture instead of just that one little silo.
Thanks, Jenny. Janet, you have your hand up.
Yeah, hey, thanks. I just want to put a plug in here. I'm not sure it's a policy rec, but to use our Health Department Universal Developmental Screening Registry for MCHAT and MCHAT follow-up results. Both those tools are in there, as well as developmental screening ASQ3 and SE. We want to add the SWIC, the Survey for Young Children's Wellbeing. I think I have that right, which is more culturally sensitive, should we say, and the MCHAT is built into that. So we plan to add that in future. But for those of you at the community level, EI, home visitors, if you would enter your screening results and they're going to save the pediatric practice from having to do that, and also vice versa, and it'll be part of our quality improvement. But if pediatricians are using the MCHAT, if they enter it in, then they're going to share it across the providers working with the family. So, you know, we are in the process of integrating the ASQ online data with the registry, and it's going to be quite robust because we have over 15,000 screens that will be then populated in there. But that tool is really the cross-sector communication tool about early screening, and there's some referral information as well of what referrals were made after the screen. So just putting that out there.
Thanks, Janet. So we are coming up on time. Any final considerations around policy recommendations or community folks we haven't heard from in terms of how this impacts you?
Beth, I'd love to just put out a reflection to folks about what I just heard everybody say about all of these different opportunities for a very complex problem that we are talking about, right? I've heard people talk about opportunities in the prevention space around how are we actually preventing, early childhood trauma and how that will support families. I've heard people talk about the need for early identification and screening and what are the opportunities for us as a network to impact that space. The next is how are we actually supporting the referral process and access to services for kids, and what are all of the different components of that? Is it professional development? Is it workforce crisis? Is it, right? What are all of those opportunities? And then there's supports for actual programs across our spectrum in the early childhood system. Is it around, this very complex system of supports with children's integrated services and special accommodations grants and all, this very complex web of things that we can offer programs? And how are we thinking about that combination of supports, the support for families, and then the collaborations between these interdisciplinary and multidisciplinary teams? So just wanting you to, as we're thinking about policy recommendations in this space, there are so many different inflection points that we want people to be thinking about as we're thinking about the life course of a child or a family's needs being identified. And what are the levers in each of those that in this next year, we can help build and support this body of work.
Thanks, Maria. Okay, with that, I'm going to transition us. Thank you all for joining us, our presenters and our partners. Again, a really complex system we've been hearing a lot about, and people are doing work, and it's not an easy one to address. So feel free to follow up with me if you need contact for any of our presenters. We're just certainly taking notes, and we'll move forward with policy considerations. Thanks, Adam, for putting your stuff. Thanks, Molly, for joining us. Yeah.
Thank you so much for hosting. Be well. Take care.
Great. Thanks, Adam. So we are going to move on with our early learning and development committee meeting. Folks are welcome to stay on, but you can also drop off as you need to. We are going to move into some kind of taking a step back even further to some of the work that we've done over the last year. And then maybe we'll have some time for some updates. I want to check in with Sherry and Dawn am I headed in the right direction? Anything else? Yes. Okay. Thumbs up from Sherry. So thanks all for joining us as you hop off. I'm going to do a quick screen share. Let's take a deep breath, move your body. Don't fall asleep here. We need you to lean in. So we're talking about you all, I love this image. Here we go. So the Vermont Early Childhood Action Plan. So ELD is one of the two committees charged with monitoring the goal 3 of the VCAP, which is all children have access to high quality opportunities that meet their needs. And so the committee over the last year has really taken quite a tour and had presentations and really discussed kind of these gaps and needs in our system that relate to all types of opportunities and services and supports that families access from prenatal period through age 8. And so I just want to briefly highlight, so this is the charge of the ELD committee, which I just talked about. And then just before we move into gaps and needs around policy recommendations, just sharing some of the key accomplishments that many of you helped us capture at the most recent VCAP summit, which was at the May State Council meeting. So for example, huge wins around increasing access to and making childcare more affordable. So changes to CCFAP eligibility, I think we can all celebrate that. That's tremendous. Also, that more early childhood educators are accessing higher ed through CCV and other higher ed institutions that we've heard about. That Vermont AEYC expanded and sustained workforce development programs, and there's as well as apprenticeship, technical career centers, et cetera. And that's due to public and private funding. We saw a launch of First Children's Finance, opened a Vermont office to provide business technical assistance to early childhood entrepreneurs. CDD developed and awarded the Sparks contract to Vermont AEYC. So really kind of leaning into the supports, the quality supports that we are providing to early childhood educators and their programs. So excited to see that work as they're hiring and getting off the ground. And then the investment in early childhood education and after school capacity building across the state. So multiple grant rounds that we saw to be able to help build. And just for one example, there were 800 new slots opened for serving 0 to 5. And I didn't have the number for after school slots, but certainly we've seen the room to grow grant program. So those were just some accomplishments. Can we just celebrate for a moment, right? Is there anything that's anyone else have a huge shout out around accomplishments in the last year? This is absolutely not a comprehensive list. We are at BBF trying to build a more comprehensive inventory of accomplishments towards the VCAP. And this was just kind of what was captured at that summit in May. So things to celebrate. Okay. So we'll take accomplishments, but I'm going to move us on just for the sake of time. So when we think about, some of you have been around this table very regularly, which we appreciate you making that time commitment, and others maybe kind of pop in and out. And just to give you a sense of some of the things that this committee has been tracking and used time at these nearly monthly ELD meetings. So certainly tracking H217, which is now Act 76. And so some of this is in language of policy needs or kind of things that we're tracking. So perhaps tracking the implementation of Act 76. We had a fascinating meeting around universal pre-K and kind of taking stock. And we heard from Sonia and Becca and Meg, and I'm sorry if I'm forgetting others, around kind of how are we doing with UPK implementation in the state, and talked about the importance of the mixed delivery system, some of the continued challenges and persistent challenges around access to special education services for kids, especially across school district lines. We talked about TSG, training, teaching such strategies, goal data. We had a meeting around children's integrated services and heard from Anne and others around CIS. We've heard over time about childcare and after school quality and capacity work. So both and anticipate, the updating of STARS and some of Sparks and some of these new or transitioned initiatives around quality and capacity. Mental health support. So Cheryl Wilcox joined us for a meeting and talked about mental health supports and kind of the relationship between early childhood and mental health for early childhood and family mental health, particularly impacted by COVID. And we've continued our discussions and tracking around exclusionary discipline. So around coordinated definitions and monitoring for both public and private programs. And then today, access to autism assessment and supports. Anything major that folks feel like we brought to the ELD table that is not captured on that list? Sure, I've missed some. Okay. So I'm going to leave the slide up for a minute and give you a moment to think about, and again, this can be a brainstorm, is what are similar to what we just did, specific to kind of autism assessment and screening and policy, what are the levers, what needs to be changed around policy or practice to be able to move some of these issues forward? What do you feel like is doable and timely in the next year in particular? Would love to hear your thoughts. I'll leave this up for a minute. Jen, I trust you're helping to take notes because I can't do it at the same time, and then can pull it down so we can fully have a discussion. What is rising up for you? Cynthia.
Hey Beth, hey everyone. So I was part of a COPE meeting yesterday, and then just listening to all the really rich discussion previously, I'm curious about the intersections with professional development and PPD. I feel like so much of this also includes or has a component of training and training capacity. And are we training trainers, or how do we make this accessible? And I guess my question is, I'm really curious about other people's thinking around how some of this content fits into, I don't know, stepped, scaffolded, supported PD system. There was a lot of work done around fundamentals and obviously orientation for childcare several years ago. And I know that there's going to be a lot through Sparks coming out, but our system has looked at the broad definition of early childhood professional development that includes, I just saw Danielle chime in, that includes children's integrated services and so on and so forth. But I don't know, I wonder if there's an opportunity to think about professional development right now, knowing that our system has just had an influx to support workforce in a variety of ways and to support childcare capacity in a variety of ways. And not to overwhelm the early childhood workforce. And I'm being very inclusive when I say early childhood workforce, I am talking broadly here, but thinking about how many of these topics touch on both training accessibility, but then capacity to actually engage and change practice and develop relationships over time. So just something that's been on my mind, given a couple of conversations around these topics lately.
Thanks. Appreciate it. Other reflections around policy needs? Yeah. Rebecca.
One thing that I'm thinking about as I look at this list is the implementation of Act 76 and Universal Pre-K, and the call for the study in Universal Pre-K and the role of the ELD committee in that study with Pre-K.
Yeah. Are there folks that are present that are also on that group? Just so we know what the connection is. BBF has a seat and there's 2 family seats, but I don't know if there are others who are sitting on that.
I am.
Sherry. Okay. Thank you.
Oh my.
Who is the second one?
Sharon. From Vermont AYC.
Okay. So ensuring that connection. Appreciate it. Others, again, we're still in brainstorm, so I'm not going to dive into discussion about any one of these quite yet, but other kind of policy or practice needs that this group is feeling called to kind of bring forward to the SAC as a policy recommendation. Or things where, I've given some examples as like potentials based on pulling from notes in our discussions, and would love to hear like if there's something listed there that is like, oh yeah, like that's not getting addressed anywhere else. And even if it's kind of a chronic thing, what needs to be brought up again? So it's just helpful to get input about what you feel like the priorities are. We can't put all these things forward, but if there were like the top 2 or 3, to help inform ELD leadership and drafting some policy recommendations. And then we will bring those drafts back to this group for final kind of editing and considerations. I am gonna put this list in the chat so everyone has it. And I pulled down the screen share just so we can see each other. This is a little bit of a messy list, but here, let's see. If you were to identify the top 2 or 3, implementation of Act 76, something specific to UPK related to CIS, like that list, childcare quality capacity, mental health, exclusionary discipline, there's some of those are intersect. What do you feel like is needed at this point?
I can jump in really quick, but I would just say, I think from just all the conversations I have with childcare practices and just in general, folks who are working with young children, I think it's so clear that a lot of childcares are struggling, whether that's, in terms of just staffing, which is obviously the major issue that a lot of places are facing. But then, as I think Cynthia was getting to not too long ago, I think it's really hard to implement new things when you're just barely getting by day to day with low staff. And it's something that we run into a lot with implementation of the ASQ online. Programs really like the idea of adding this new component to their system. It'd make their life easier, but finding the time for even just a 45-minute training can be a challenge. And so I definitely think that anything we can do to support childcare is whether that's just, having dedicated trainers that can work, like allow for training on demand for childcares or, whatever it is, I think there's a lot of effort that could go into childcare that would really provide progress in a lot of different ways, if that makes sense.
Super. Other priorities? Is anyone having trouble being like, they're all important? Yes.
Can I just add just a little something, like we're thinking about like the workforce support and benefits, and it's something that came to light during COVID, but I feel like has sort of taken a back seat now. But it's something that I think we need to pay attention to and prioritize, is making sure that our childcare workforce has access to a medical home, medical care, and health insurance, especially as we move towards a more well-compensated profession, which we absolutely should be doing. But currently, a lot of people's health insurance premiums are through Vermont Health Connect, and that is based on your income. And so when your income increases, your premiums increase. So do your student loan payments, all of these things, right? And I just think one of the priorities needs to be the sort of logical results of increasing people's wages and how that continues and what a stressor that is on teachers, right? Like when we give our teachers raises, some of them would prefer not to have a raise because they're afraid they won't be able to afford health insurance. Like there's just some areas that, like, until you can address basic needs, right? And when I'm talking about the basic needs of all of the stakeholders, families, children, and educators, then there's still going to be, it's really hard to hold space and be open and engage in more training and engage in new initiatives and continue to show up for the work if your own basic needs are not met. So I just wanted to like put that out there because it feels really foundational to anything else we want to build on.
Thank you. So true. Other reflections as we are gathering input to build some policy recommendations? Katie.
Okay. Yep, I put in the chat the exclusionary discipline piece with suspension and expulsion. Right now, I know we don't really have control around the guidance that is with the interim secretary and with the deputy. But just kind of looking at, along with early MTSS, since that is part of our PDG, which is great, that should help reduce. But you know, paying attention to the data that we have about the long-term effects with suspension, expulsion of young children and what that can happen with, and just expanding that knowledge and what supports are available for programs and for our children and their families.
Thank you.
So I was trying to be quiet, but I just want to say that from where I sit at Let's Grow Kids, the Universal Pre-K Study Committee is really important to field and families. So to me, that is elevated. We get more inquiries, more questions all around, like, what's that all about? What's that going to look like? What's like, that seems to be something really important to the fields that we represent and families. And I also would like us to be thinking about exclusionary discipline in the frame of like, what resources can we make sure are available at several different intersection points for early childhood educators and families, and kind of trying to flip that. I think the narrative, at least from the community-based programs, is that has been communicated and rolled out in a way that feels more punitive rather than supportive and solution focused. So, and I would just like to flip that. And at Let's Grow Kids, we've been getting some TA from some national organizations around a couple other states that are trying different strategies that are getting some good results.
Thank you all. So I am tracking the time. Some great discussion and engagement, and appreciate you sharing the space with the Child Outcomes Accountability Team folks too. I think I want to kind of close it up right now around the policy recommendation discussion, and see if there are any updates or announcements or questions, given who's here, and spend the last couple minutes together. So does anyone have anything? We can do a popcorn style.
I will just say the Universal Pre-K Study Committee is meeting Friday.
Yeah.
For the first time. It'll be 18 meetings.
Thanks. Cooper?
I just wanted to put a reminder out there that Help Me Grow is offering some ASQ trainings this summer. We have 3 still coming up. One is next Thursday from 1 to 4. That's July 20th. We have a training from 9 to 12 on August 15th. And then more recently, we added a 3rd ASQ training on August 29th from 9 to 12. So just a reminder to folks, if people are interested in signing up, they can email us at info@helpmegrowvt.org. And we look forward to being joined by lots of folks. We have about 60 people in our biggest group so far in our August 15th training. So we are looking forward to joining folks, and please feel free to reach out if you have questions.
Thanks, Sharon. I'm sure there's nothing going on at Vermont AYC for you to give an update.
My goodness, that is kind of funny to say. Things are going well. They're hopping. And I did hear you reference, the hiring for Sparks, and I just thought maybe people would be curious how that's going. And we have had a tremendous response to those positions that have been announced so far. A strong candidate pool. Jen Severance is serving on the committee, and I think that we are so optimistic about having a really strong team hired really soon, and then we can really build out and really share, the services that we're going to be able to offer. But it's been really positive. The interviews so far have been fantastic. So that's good news. I also just wanted to mention that the conference registration will be probably being launched within, the second week of August. So just want to make sure folks are aware of that, and to be sure to spread the word about nominating for the awards, the Early Childhood Educator of the Year Award and all the other awards. We actually haven't received the typical volume of nominations. So if you could really promote that, it would be really great, so that we can recognize people for their good work. So I'm sure there are other things, and feel free to ask if I haven't mentioned it, but those were first things that popped in my mind. Thanks, Beth.
Thank you.
I muted myself. So I just wanted to remind folks that the webinar that was originally scheduled for Tuesday was postponed until the 18th, and it will be again at 1 p.m. and 6 p.m. I believe everybody who had signed up for it was able to get a notification that it had moved, where that was, we tried a new thing. And then there is a survey to the field being worked on shortly that will be released shortly afterwards to inquire about the readiness payments and where the field's priorities were sitting as we start to make that formula and figure out the quickest way to disperse that money for the needs that folks have expressed that they have. And I know, Sherry, you're getting a lot of inquiries. We're trying to move as fast. We're trying to get that train as far down the tracks as humanly possible. But
I tell them, you need to get the money out quickly. You're working on it. That's
I was getting pinged by Janet all through this meeting. So we're on it.
Definitely. Hey, Jen's really busy taking notes for all of us, but I want to let you know, First Children's Finance put together 5-minute videos, and and there's Rose. That's what she was probably going to share. Okay, you share, Rose. I'm going to put it in the link.
Oh, great. Yeah, I can. Thank you so much. Yes, I was just wanted to share, yes, that we have some short videos. There are about 4 of them to really just help explain some of the changes or things that are going to happen with the childcare businesses. So they're just short little videos on 4 different little topics, and just to try to help providers understand some of the things that are changing. So yeah, if you could share it. It's right on our website. It's great. Thank you.
I forgot to add one thing, which is Amy Bolger. Her last day with us is on Friday. So we are going to be posting her position very shortly. We have that in the works. So much like Vermont AUIC, we have a number of positions between the PDG positions, the positions that we gained through Act 76, and a couple of openings or staff movement transitions. So if anybody wants to work in state government, we'll be ready for it.
Awesome. Well, if there aren't any others, there's a lot going on. Where did our July go? Is what I'm thinking. We have not talked at all about flood response and recovery, but certainly at BBF, we are just paying attention to kind of where the gaps and needs are for children and families. I think there's a lot of mutual aid popping up, which is amazing. But if you do see that there are gaps and needs for the families that you're working with, let us know. Be in touch with me or a regional manager so that we can kind of help message that to the right people. So I think people are just kind of picking up the pieces and figuring that out, but we'll probably have a better sense in the next couple of days and weeks. So hope all of you stay dry and well. And we are planning an August meeting for ELD. So make sure that's on your calendar, and we'll see you soon.
Thank you, Beth, for facilitating.
You're welcome.
Bye, everyone.
Bye.
Thank you.